That was your podcast for today. We will be having Mr. Frederico on the line, and we will be speaking to him about what is a few questions that we do have lined up for him. I hope you guys will stay tuned to the rest of the OFM program. Mr. Frederico, how are you doing?
I'm good, Duncan. Thank you for having me again.
It is always a pleasure to have you right here on OFM. Mr. Frederico, my first question to you is looking at the whole podcast that has been up and going, I just quickly want to know which platforms should the audience be more careful with in terms of the anti-vaccination propaganda, traditional outlets, or social media?
Well, I mean, social media is where most of it is coming through to most people. The stuff that we're dealing with and that we're confronted with at the moment. It's definitely social media, and it's definitely WhatsApp at the moment seems to be a problematic platform where people are just sharing all sorts of content, and where we seem to be getting most of the vaccine-related disinformation at the moment.
Does getting the vaccination mean that one will not test positive for COVID-19?
No, I mean, a fully vaccinated person. So here's what the vaccines do. The vaccines prevent you from getting sick. The vaccines prevent you from being hospitalized and needing oxygen, as a lot of people at the moment need and are struggling to get. The vaccines prevent you from dying. What the vaccine does not prevent is the virus actually entering your body. It's not like the virus can smell when somebody's talking to you and somebody who's infected, and they're talking to you, and the virus travels on these micro droplets from their on their breath to your face. It's not like the vaccine in these micro droplets then can sense that, okay, this one has been vaccinated, so I can't enter, so let me fly over there. No, the vaccine doesn't do that. The virus doesn't do that. The virus still enters your system.
Yeah.
Still infects you. It's in your body, but it doesn't make you sick, and it doesn't. And you you won't end up in hospital, and you most probably won't die. So that's what vaccines do. They don't prevent an infection. You still get the virus in your body if you're amongst infected people. You just won't have those other effects that health, the outcomes that would require you to. So basically, the vaccine stops an infection occurring. It doesn't stop the virus from entering your system. So people think if you so you can test positive, but you won't get sick also.
Yeah.
From, as I said, you won't get sick, you won't be hospitalized, you won't die. That's what the vaccines prevent, is to keep you alive, basically. But no vaccine is 100%. No vaccine is perfect. So what they refer to as breakthrough cases, which is cases where the virus actually breaks through the vaccine.
Yeah.
You do have those cases where somebody actually gets the disease, COVID-19.
Yeah.
And actually there is an adverse outcome. So it does happen because no vaccine is perfect.
Yeah.
But according to, sort of the studies and health authorities, those sorts of outcomes are very rare. That there is a breakthrough with the vaccine in terms of a fully vaccinated person. I have to make that clear. A fully vaccinated, you've had both your shots. Now, a person who's just had one shot can still get COVID-19, the disease, like I had. I had a mild symptomatic COVID-19, but I only had one shot. So I'm not fully vaccinated. But a fully vaccinated person, um, you know, the disease the should prevent um, should should be able to ward off the disease. In other words, that a vaccine prevents that person from actually developing the disease COVID-19.
Yeah. Has the World Health Organization released the third phase data for the Sinopharm yet? And if yes, what are the findings?
So the Sinopharm trials are only coming to an end. I think September, October this year, which means that's when the final phase 3 trial data will only be available. But what they have released is enough data to get sort of interim data from the trials to be able to get emergency use listing with the whole World Health Organization. But that goes for all of the vaccines, So the all of them have emergency use listing.
Yeah.
The all of the vaccines that are currently being administered around the world.
Mhm.
None has final approval. So for all of them, there is still data outstanding because they are still sort of in a trial phase. They are still being tested and so on. That's why they have emergency use listing. Now, all of them, um, the ones that have already um, been approved for emergency use, uh,
Yeah.
uh, uh, that are being administered. All of these vaccines um, will. I don't see how that and according to what I've read and so on, that any of them will not be approved eventually
Yeah.
once the final data is in on all of them. Because what's happening at the moment is real time testing in this pandemic, which is something that vaccine developers usually don't have, where they can actually test um, in a real world setting how a vaccine works. But this pandemic is actually a global real world test where we can actually see in real time how the vaccines fare and how they work.
Yeah.
Um, so, and the data of all of them is actually very good in terms of preventing, sort of severe disease, preventing hospitalizations, and preventing deaths. The data is actually very good on all the vaccines. So this is something that, people probably I mean, the disinformation has also been that these vaccines aren't fully approved. They are experimental drugs. That's why they only have emergency use listing. Um, but there's more there. People should understand what the processes are um, for why they're getting emergency use listing and why how the eventual approval process then works.
Yeah.
Um, so, I mean, there are processes, but that doesn't mean that the vaccines are unsafe or that they are experimental. You have to remember these vaccines are based on techniques, vaccine development techniques and technologies that have been around a while. So there's nothing new here. Um, these processes have just been sped up in order to make these vaccines and have them actually come through faster than what would have ordinarily been the case. But the reason they have emergency use listing is because um, they they um, um, they are actually still being trialed, um, and they're actually still have to be get full approval.
My last and final question to you is what are the four vaccines that are authorized and which countries are they being distributed in?
So I mean, they are not just for vaccines. I mean, all of them at the moment only have emergency use authorization. So you have different vaccines being used in different parts of the world. Um, so let's see, there are the Pfizer, Moderna, and Johnson and Johnson vaccines are being used in the U.S. Um, AstraZeneca, um, Pfizer, and yeah, AstraZeneca, Pfizer are the main ones in Europe.
Yeah.
Um, then there's Sputnik 5 from Russia, which is being used in various countries around the world. Then you have um, AstraZeneca, Sinopharm, Sinovac, um, Sinovac, um, and then I think there's Novavax, which is the latest one.
Yeah.
Um, so I mean, we're talking about we're talking about we're talking about 8 vaccines that have emergency use listing at the moment. I think that are being used in various parts of the world. In Namibia, we currently only have AstraZeneca and Sinopharm.
Yeah.
We're trying to get, as I understand from, I mean, what the ministry has said, we're trying to get Sputnik 5, the Gamaleya, which is called Gamaleya, the Russian vaccine. And I think we're trying to get Johnson and Johnson as well into Namibia, the
Mm.
the, the Janssen vaccine. Um, so all in all, there are about 8 vaccines now. All of these vaccines are based on technologies, 4 different methods or technological vaccine development methods. And I mean, I would encourage people, if you want to know what these methods are and what exactly they do, I would encourage you for a, a brief description of the 4 different types of vaccines to go and visit the World Health Organization COVID-19 vaccine page. They're very accessible. They give you sort of in a Q&A style, they explain to you what the 4 different types of vaccines are. And
Mm-hmm.
then if you want more sort of more in-depth information about this, I would encourage you to visit the Johns Hopkins University COVID-19 vaccine pages, where they have blogs, and they also have really nice breakdowns of what these 4 types of vaccines are. So this information, if you Google it, if you have the data and you Google it, the 4 different types of vaccines, that information should come up immediately.
Yeah.
Um, and if you want to then go further, go and visit the Johns Hopkins University, or even the CDC, the U.S. Centers for Disease Control and Prevention, COVID-19 disease, or vaccination pages, vaccine pages. The explanations are very accessible. They're very simple, and they explain exactly what the different vaccine types are, and what how they work, how they, for instance, the inactivated virus vaccine, the adenovirus vaccines, what that is,
Yeah.
how that works, the mRNA vaccine type, which are the Pfizer and the Moderna vaccines. So I mean, you can go and read up about these things. This information is there; it's accessible. I
Yes.
do encourage people, if you want information, go and get it from these credible sources who can explain these things, and they have already explained these things. The information is there. So there's no need for you to take the word of some anonymous voice note posting or video in your WhatsApp groups. Go and look at what these credible sources are saying, what these vaccines are. They're not experimental. They're not poison. They're not going to kill you. Go and read up about them. Educate yourself. Don't believe the lies. Don't fall for the falsehoods. Please, um, be responsible.
Mr. Frederico, thank you so much for joining me on 91.0.
It was a pleasure, Duncan, and I look forward to engaging with you again.
That was Mr. Frederico there, who was busy talking about the vaccines, the different types of vaccines. Did the World Health Organization approve 3 phases of data with the Sinopharm vaccine? Does getting a vaccine mean that you cannot test positive, was one of the questions. And then which platform should the audience be more careful with in terms of the anti-vaccine propaganda?